Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Chiropractic. Introduction. Chiropractic is healthcare that focuses on disorders of the musculoskeletal system and the nervous system, and the way these disorders affect general health. Chiropractic uses a type of hands-on therapy called spinal manipulation or adjustment. Many people go to chiropractors for treatment of low back pain. Doctors of chiropractic, or DCs, believe the body can heal itself if the bones and muscles of the body are properly aligned. This means healing can take place without surgery or medication. This is why DCs adjust muscles and bones to take pressure off of nerves in the body. This program will help you understand chiropractic. It discusses the benefits, risks, and what to expect from chiropractic treatment. What is chiropractic? The term chiropractic is made up of the Greek words chir and praxis. Chir means hand and praxis means practice. Chiropractic is a term used to describe a treatment done by hand. Hands-on therapy is central to chiropractic care. Doctors of chiropractic, or DCs, believe the body can heal itself without surgery or medication. But to heal, the bones and muscles of the body must be aligned. To properly align bones and muscles of the body, DCs use a type of hands-on therapy called spinal manipulation or adjustment. Using their hands, DCs manipulate and adjust parts of the body. This is done to restore mobility to joints restricted by tissue injury. Tissue injury may be caused by a traumatic event, such as falling, repetitive stress, such as sitting without proper back support. Spinal adjustment is not unique to chiropractic care. Other healthcare providers, such as physical therapists, may use spinal manipulation. Chiropractors often use other treatments in addition to spinal manipulation or adjustment, such as nutritional counseling, exercise, physical rehabilitation. Benefits. Chiropractic care is thought to be a safe and effective treatment for many cases of acute low back pain. This is back pain caused by a sudden injury. Such an injury may happen when moving heavy objects or getting tackled as part of a sport. Chiropractic may also be helpful in treating neck pain and headaches. People with osteoarthritis and fibromyalgia may find relief from their symptoms through moderate pressure. This technique is used both by chiropractors and deep tissue massage therapists. Therapies in which pressure is applied to the body using hands were recently studied. The study found that spinal manipulation may be helpful for several conditions. In addition to back pain, this type of therapy may help with migraine and headaches caused by neck injury, neck pain, upper and lower extremity joint conditions, whiplash-associated disorders.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Risks. Chiropractic adjustment should only be performed by a trained and licensed doctor of chiropractic. Serious problems related to chiropractic adjustment are very rare. They include a herniated disc, compression of nerves in the lower spinal column. This can cause pain, weakness, loss of feeling in your legs, and loss of bowel or bladder control. A certain type of stroke, called vertebral artery dissection, after neck manipulation. People who have certain medical conditions should not undergo spinal manipulation. These conditions include osteoporosis, spinal cord compression, inflammatory arthritis, a condition that requires the use of blood-thinning medication. If you have a history of cancer, talk to your healthcare provider before you have a spinal manipulation. Your healthcare provider can help you decide whether the treatment is safe for you. Before chiropractic. During your first visit, the chiropractor typically takes a health history. He or she will perform a physical examination with a special emphasis on the spine. Other examinations or tests such as X-rays may also be performed. If chiropractic treatment is right for you, you will work with the chiropractor to develop a treatment plan. During chiropractic. The goal of treatment is to increase the range and quality of motion in the area being treated. Joint mobilization is another type of manual therapy that may be used. During the adjustment, the chiropractor may place you in specific positions. This allows the chiropractor to treat affected areas. You may lie face down on a special padded table. The chiropractor will use his or her hands to apply a controlled amount of pressure to a joint. This is done to push the joint beyond its normal range of motion. During the adjustment, it is common to hear popping or cracking sounds. Chiropractors may combine the use of spinal adjustments with other treatments. These include heat and ice, electrical stimulation, relaxation techniques, rehabilitative and general exercise, counseling about diet, weight loss, and other lifestyle factors, dietary supplements. Although the length of time varies depending on your needs, spinal manipulation or adjustment often takes less than an hour. After chiropractic. A follow-up visit is often scheduled after the first adjustment. Chiropractic treatment often requires several sessions. Some people do not respond to chiropractic adjustments. If your symptoms do not improve after a few weeks of treatment, it might not be an effective treatment for you. If this happens, talk to your regular healthcare provider about other treatment options. It is important to tell your regular healthcare provider about any treatment you receive.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Doctors of chiropractic believe the body can heal itself. For this to happen, the bones and muscles of the body must be properly aligned. They use spinal manipulation or adjustment to adjust muscles and bones. This takes pressure off of nerves in the body. Chiropractors use their hands to apply a controlled amount of pressure to a joint. This is done to push the joint beyond its normal range of motion. The goal of treatment is to increase the range and quality of motion in the area being treated. This should aid in restoring health. Chiropractic care may be helpful for back pain caused by a sudden injury. It may also be helpful in treating neck pain and headaches. Chiropractic adjustment should only be performed by a trained and licensed doctor of chiropractic. Serious problems related to chiropractic adjustment are rare but serious. They include a herniated disc, compression of nerves in the lower spinal column, and vertebral artery dissection. Some people do not respond to chiropractic adjustments. If your symptoms do not improve after a few weeks of treatment, it might not be an effective treatment for you. If this happens, talk to your regular healthcare provider about other treatment options. It is important to tell your regular healthcare provider about any treatment you receive.
Thank you for using Explain.